Welcome to your Daily Dose. My name is Robert. You know my pal Susan Scarlett. She's up here with me. I'd also like to introduce Dr. Indu Subramanian and Dr. Bradley McDaniels. Thank you both for joining us.
Thanks for having us, Robert.
So, the reason you came across my path, well, Brad, we met back at the PMD Alliance, and we found a lot of things in common, both going toward a doctoral a little later, and yours with the influence of your mom having Parkinson's. And then Indu, I heard you at a conference I was keynoting with Larry Gifford at the Muhammad Ali Center last month. And as you were speaking, I have to say, my jaw was on the floor. I go, she's talking improv, but I don't know if she knows she's talking improv. There was so much crossover in our work for Brad and for Indu. And it turns out you both have a couple of new papers that seem to speak toward this broad thing that I would look at, I guess, as prescriptive wellness, and the idea of looking at Parkinson's beyond merely the physical. So I'm going to open up there, and either one of you, if you'd like to take this, why is it important to look at Parkinson's beyond merely the physical symptoms?
Indu, I'll let you start.
Okay. So, I think that we've sort of branded Parkinson's as a sort of motor disease that happens probably, and if you look at the images that we teach our students around, this sort of older white man, who is bent over and stooped, and we have this mnemonic that we teach our trainees about, TRAP, it's spelled, so tremor, rigidity, akinesia, postural instability. These are the medical words for, tremor, stiffness, slowness, and sometimes, balance issues. And really, we've focused on that. So if you happen to be a trainee and you go out and become a family doc or something else, this is sort of all you know about Parkinson's. And when we sort of have now fast forward into 2023 and beyond, I think listening to our patients, we become much more sort of understanding of the things that really make their quality of life different and who is not being served well in sort of our current paradigm. And it's really this sort of concept that we have motor symptoms that are obvious, but then a lot of non-motor issues that are going on in the background. So this stiffness, slowness, tremor is something that's obvious to me as a doctor, but really when we talk to patients, it's the depression, the anxiety, the apathy, sometimes the constipation or urinary issues that really bother them. So I think, that's really what we were trying to pivot to, is sort of this non-motor sort of flavor, and then also focusing on mental health, which I think we all understand can really impact our day-to-day lives. Having lived through the pandemic, I think we realized that mental health can really make or break how your day's going, how your year is going. And I think we've really underserved that area of Parkinson's treatment. And so I've been, exploring this with a number of interviews with some patients' voices, as well as trying to open up to everyone who might touch a Parkinson's patient or person living with Parkinson's. And so Brad and I and Greg Pontone, who's a psychiatrist, have been having some just really lively and robust discussions just about, we meet a person on this day, of their diagnosis, how would we approach them in the ideal world? How would we sort of want to serve them better so that it's not so reactionary? Many of the times we're hearing about something after the sort of, cat's out of the bag or whatever, where we're sort of trying to then react to a bad situation where somebody has, a bad episode of depression, ends up needing to be hospitalized, or having a bad impulse control issue, or other issues that are way down the road. And a lot of folks and their families say, I wish I had just known that this was something that was part of my Parkinson's, or that there was something that I could have done to prevent some of these things from happening.
Indu, there's a ton to unpack there. That was spectacular. Bradley, if you'd like to jump in on anything in particular, because you have the perspective of a person living with Parkinson's as well as being a doctor.
Yeah, it's I think Indu hit everything very broadly, what we've covered. And one of the challenges that I think is critical, most movement disorder, I should say all movement disorder docs know how to treat the movement of Parkinson's disease, right? It's very common. You come in, here's your Cinemet, I'll see you in 6 months. And that's kind of where this discussion for us began. And understanding, me hearing from my mom what it's like when she goes to see her movement disorder specialist. And I say, Mom, what did you guys talk about? And she says, you go through the whole UPDRS stuff and they go, yeah, this is your score. You're doing better or worse. We're going to add a Cinemet to your dose and we'll see you in 6 months. And I said, Mom, but did they ask you about mental health? Did they ask you about how you're feeling? Did they ask my dad as a care partner how he's doing? Right. And so those things are really what led Greg and I into these discussions, because we're saying, what's being missed?
Yeah.
You know, and the literature is really clear about how infrequently patients are asked about their mental health when they go in to see an MDS.
So
Right.
this is great. I think that's a good jumping off point. I'm gonna hit right here and say that's the end of the first daily dose. We've set the table. We're gonna unpack this in a big way. Susan, you're gonna have first word when we come back. Okay. All right. See you in a moment.